In this video, we're going to work on the digestive system. Part of what I do as a physical therapist is visceral manipulation, and I'm getting a lot of requests now during this home time about what people can do for themselves at home to facilitate digestion. So when we work on the digestive system, the first thing we do is release the sphincters of the digestive system. So I'm going to bring you through a self-treatment method to work on your digestive system. And you can do this at home. It's the perfect thing to do at night before going to bed. It's a great way to shift from that sympathetic to parasympathetic or rest and digest state. So lie on your back with your knee bent. When you're doing this work, you want to be directly on the skin. So, to begin, we'll find some bony landmarks. First, take your left fingers and bring them to your navel. And then take your right fingers and bring them to that front bony hip point on the right, your ASIS. And now draw a line from the ASIS, or the front right hip point, to the navel. About halfway between there, you'll find your ileocecal valve. This is where the small intestine and large intestine meet. And we'll assess that by pressing down like you're taking up the slack of the skin and moving into the fluid viscera, almost like taking up the tension on a spring. And then now when you release that spring, there'll be inherent rotational motion in the sphincter. The rotational motion associated with digestion is clockwise, so from the right to the left. So we're looking for a rotational motion in the clockwise direction from right to left as you release that spring. If it goes counterclockwise, don't worry. Now I'll show you the intervention. So again, to find the ileocecal valve, find a spot halfway along the line from the front bony hip point on the right to the navel. Place your palm in that halfway point. Push down, gently of course, into the viscera, trying to sense that sphincter under the hands. And as you release, if it goes counterclockwise or to the right, as you lift off, follow it to the right. Maintain that right rotation, taking up the slack as it twists to the right, following the body, pausing there, and then like a tide, you'll feel that sphincter start to unwind back in the clockwise direction. And when it's finished rotating back towards the direction of digestion, then you're complete. And now we'll move up the chain. So we started with the last of the sphincters so that we're clearing the gate for elimination. So moving up from there, we'll come into the small intestine and we'll come to the DJ junction where the duodenum and the jejunum of the small intestine meet. To find this place, bring your left fingers to your navel, and then now 3 fingers above the navel, just off to the left, maybe about 1 inch to 1.5 inches. You'll be able to find a somewhat hard spot, about a marble or dime size under your skin, and don't press too hard. The harder you press, the harder it is to find. So keep the pressure light and just feel for changes in density. In these places, if there's dysfunction, you may even feel a sense of sensitivity. So now, take your palm, try to stay with one palm to that spot. So up 3 fingers, slightly off to the left, feeling for a dime, a little bit of a hardness spot underneath the skin, take your palm there, push through the superficial tissues into the fluid, viscous abdomen, taking up any slack. Compress it like a gentle compression of a spring, so that as you slowly release, like an elevator rising, you'll feel the inherent rotational nature of that sphincter. And we're looking for a clockwise direction, from right to left, in the direction of digestion. If it's going clockwise, good, we'll move on to the next one. If it's going counterclockwise, I'll review the treatment one more time. So you press down, taking up the slack of the superficial tissues, moving in and trying to sense for that sphincter under your hand, using your palm, and then slowly releasing. If as you release, like an elevator rising, you start to go counterclockwise towards the right, follow it in that direction. Pause here, taking up the slack, letting the body lead you. And then like a changing tide or gentle magnetism, you'll start to feel the body correct itself. And the body is going to start to move the relaxed hands into a clockwise direction. Once that clockwise direction completes, and once any pulsing or warmth, or you get a big sigh, comes out, then you move on to the next spot. Moving up the chain, now we're going to the sphincter of Oddi. This is where the liver and the gallbladder drain bile into the upper portion of the small intestine. To find this, take your 3 fingers just above your navel again. It's directly opposite of the DJ junction. So 3 fingers to the navel. Now this time slide off about an inch or an inch and a half to the right. And here you should feel the sensation of a pea under your skin. It may even be a little tender. Think of it like Princess the Pea. You want to touch or palpate gently for that little pea-like structure deep beneath the skin. If you're pressing really hard, you probably won't be able to sense it. Once you find that little pea, 3 fingers up and about an inch to an inch and a half over to the right, place your palm there. Again, assess this sphincter by pressing down and taking up the slack like you're gently loading a spring, so that you can sense past the skin into the tissue you're trying to assess, and then gently release, slowly removing the pressure like an elevator rising. And then as that pressure lifts, gently feel the inherent rotational nature of that sphincter. We're looking for clockwise rotation again in the direction of digestion. So if as you release, you get a clockwise motion from right to left, perfect, continue on. If it continues to go counterclockwise or back to the right, follow it until the body heals itself, self-correcting, releasing, and coming in sync with a clockwise rotation. Continuing our journey upward, now we're coming to the bottom of the stomach, or the pyloric sphincter, where the stomach and small intestine meet. So now take your left hand, taking the pinky side of the hand to the navel. Fold the hand up so it's resting on your belly. Pinky side against your navel. Right in the hook of the thumb, between the thumb and the index finger. If you place your right index and middle finger there, you should find the pyloric sphincter. It should feel about quarter in size and quite hard underneath your fingers. Again, don't press too hard, don't be too pokey. You're observing and sensing. The softer, the better. And now, take the heel of your right hand to your pyloric sphincter at the bottom of your stomach and gently feel into it, adding a little bit of compression, not too much, taking up the slack of any superficial tissues so you're sensing the sphincter under your hands. Then release slowly. As you release, feeling the inherent rotational nature of the sphincter, looking for a clockwise directional motion in the direction of digestion. If it goes clockwise, excellent. If not, no problem. Follow the body where it leads, bringing it counterclockwise. Until it starts to correct itself and you feel that subtle tidal or magnetic pull into a clockwise rotation. The last sphincter is the cardiac sphincter, or the lower esophageal sphincter. This is where the esophagus ends and the stomach begins. To find this now, take your fingertips right to the bottom of the sternum or the bottom of your chest bone, and then slide them just off the chest bone to the left. So towards the heart, right at the beginning of the ribs. And then you'll feel for a little spring on those ribs. There should be a little spring, and then you maybe come up like one rib segment and it feels dense. Like when you push down, it's hard underneath it, or there's no bounce or recoil. And then if you come up again, you'll come back to a sense of a little spring or bounce or a little hollowness under the rib. So palpate or feel the ribs for where along that, if you press, it just feels a little denser. That's your cardiac sphincter. So remember, come right on the skin. So I'm gonna come under here and I'm gonna come in with my palm. My palm is right on the cardiac sphincter. I'm compressing gently, taking up the slack of the moving through the superficial tissues till I can engage with the anatomical structure of the sphincter. I'm sensing into it, giving it a little compression like you're pushing down gently on a spring. And then as you rise slowly off like an ascending elevator, as you come out of the tissues will take you into inherent rotational motion of the sphincter. Again, last time, looking for clockwise rotation. If it goes counterclockwise, listen to the body, let the body be your guide. Follow it in the clockwise direction, taking up the slack until you feel that tide change and that rotational energy reverse into the direction of rotation, which is right to left in the clockwise fashion. And now we've gone through all 5 of the digestive sphincters. Doing this work will be very beneficial in both upper and lower digestive problems. A lot of times if you have any heartburn, acid reflux, beginning down here and opening the pathway will help relieve these symptoms. So give it a try, even if you're feeling anxious or nervous, have anxiety or difficulty sleeping. This work can be very helpful, shifting you into that parasympathetic state of rest and digest.